Let's take a look at an endodontic case. This image is taken at 70 micron voxels, 4 by 5 centimeters custom field of view. Under the axial view, do you see this tooth that has undergone a root canal treatment? Center the circle on the tooth in question and align the axial line along the long axis of the tooth under the sagittal view. You'd find the tooth under the coronal view. Here you can confirm the tooth number 9 post and core crown treatment case. The important first step in assessing the endodontic case is to realign the axial lines under the 3D module. You can use either the scroll bar or the mouse wheel to move through the slices along the long axis of the tooth, moving in buccal, lingual, mesial, distal dimensions. Let's sharpen the image using the filtering and thickness function. Under the 3D rendering, let's visualize the gutta percha and endopost by manually adjusting the CT grayscale values. First, select the bone mode preset. Then, double-click on the fine-tuning button. Next, find the higher order density value suitable for visualizing the filled gutta percha. One can inspect the state of the gutta percha filling using this method. It is common to find overfilled gutta percha after a root canal therapy. This can be valuable for working length determination before root canal filling as the last step in the treatment. It should be noted that low-dose custom field of view scans are crucial for this effort. Let's take a look at the second case. What should we do with the 3D CT rendering if we want to measure the canal length of a tooth? First, align the axial lines under the axial view. Next, align the axial line to the long axis of the molar in question. You will notice the adjusted coronal view. Now align the axial line once again to the long axis of the tooth. The tooth is now optimized for sagittal view. Click the Enter key to remove the lines. Click on the tape line icon under the Measurements section, and we will measure the canal length. In this fashion, we can accurately determine the endodontic work length of a tooth by utilizing the power of the 70 micron voxel size. The benefit here is that you can determine a more accurate working length measurement when compared to periapical radiographs. Please click along the visible outline of the canal and then double-click to finish. The total canal length will appear. For this case, let's hover over the ancillary features that can be used in endodontic treatment planning. If you look at this molar, you'll notice there's an extra canal in the mesiobuccal dimension. In order to look at it more closely, we can colorize the image based on the density value and identify the canals. Next, click on the Dynamic Lightbox tab and locate tooth number 14, the upper molar. Use the cube function to create the 3D zoom view, which will enable you to identify the root apex of the tooth in question. You can rotate and inspect the root tip in 3D. The benefit here is that conventional 2D images cannot visualize the shape of the root as you can in 3D. The oblique slice feature allows you to make a 3D segment of the tooth in question and inspect all around it as you rotate the axis. Lastly, let's touch on the endo function. Endo function allows one to inspect the crestial bone height and internal canal structure in 3D rendered images. That completes our session on endodontic treatment planning. We'll meet again for the next clinical session.